Division of Health, Wellness and Social Protection, Assemblyman Dr. Faith B. Israel, to address you.
Good morning. Good morning to the members of the media. Good morning to my colleagues. It is certainly a pleasure being here this morning, doing something that my tertiary education professors always said. They always said that if it isn't measured, it does not exist. And I want to congratulate our Chief Secretary, Farley Chavez Augustine, for his insight and for him ensuring that we are held accountable. Because when we contested the election, we did it telling Tobago people that we would be better, that we would do better, and using a very public mechanism like this is forcing us to live up to those mandates. It's an honor to present the achievements of the Division of Health, Wellness and Social Protection. I would like to, before I start though, say a very hearty thank you to my Assistant Secretary, Mr. Sonny Craig, who has worked closely with me over the last couple months. I would also like to thank the administrators who've been at the division for the last couple months. We've had 2 so far, and a third one is assuming this morning. And I would like to thank those administrators who, who've worked very hard over the last couple months to ensure that we actually provide what is necessary. And probably most importantly, I would like to thank the hard-working technical team that is a part of the Division of Health, Wellness, and Social Protection. IT guys, you're telling me something. Go ahead. Okay. So I would like to start by talking about some of our achievements. The first of those achievements is the Roxborough Hospital. As of the 1st of April, I am proud to indicate that the Roxborough Hospital is actually opening and is actually functioning using hospital services. As of the 1st of April, we currently have outpatient services happening at the hospital, and that includes urology, renal clinics, OBGYN, peds, and internal medicine. As a matter of fact, if you are part of those clinics in the Scarborough General Hospital and you live in the eastern end of the island, you should get a call stating that you can come to Roxborough to have those services available. The same applies to dialysis. We have the capacity to do at least 6 seats used at the same time. So that will also be available. That is also available. Again, if you are one of those individuals who are dialyzed at the Bacalet Health Center, expect a call, and you live on the eastern end of the island, expect a call to start having those services available at the Roxborough Hospital. You will also be able to access medical imaging at that facility. It's important to note, though, and this is one of the things that we need to be very clear about, that even though at the Roxborough Hospital we are able to provide the outpatient services, dialysis, and medical imaging at this time, we are not able at this time to provide emergency services. So if you actually need to go to accident and emergency, you would still need to go to the Scarborough Hospital. We are also unable to provide ward services at this time. So all of the inpatient services, we hope that at the end of the next mandate Monday, we would be able to announce those services are available, because the target date is June 1st for those services. One of the things that we need to be conscious of is the fact that the Tobago Regional Health Authority has been an organization that has been in limbo for quite some time. In limbo because every 5 minutes we seem to be getting a new CEO, we seem to be getting new leadership and so forth. So one of the first things that we did coming in was to ensure that we put some stability within the Tobago Regional Health Tobago Regional Health Authority. And we did that by ensuring that we hired a chief executive officer who has been working very closely with the administrator, the assistant secretary, and myself. We've also ensured that we've hired quite a number of senior managers. So you would recognize now that when people talk to me or when people call me to ask about HR issues, for example, I let them know we now actually have a general manager for HR, or we now actually have a general manager for operations. We now actually have general managers for these key services, and that is helping us manage the healthcare within the Tobago Regional Health Authority, which is what is necessary at this time. Coming out of the retreat in January, one of the things that Chief Secretary Farley Chavez Augustine spoke about was the fact that we wanted to ensure that all of our members of staff, particularly those members of staff who had been working so hard over the last 2 years with this pandemic, those members of staff who came on these short-term contracts. Many of them were given contracts for a month and probably up to 3 months. We wanted to ensure that those individuals knew that we thanked you for your service, and we wanted you to know that you are going to continue working with us. So we have started the process of implementing the 3-year contracts coming out of that. It's important to know, though, that we are using a rolling mechanism to have this done. What does that mean? We do not want a situation where every single person starts their contract on the first day and ends their contract 3 years later. That is going to be an HR logistical nightmare. So what we're doing is looking at the date, looking at the time that their current contract is coming to an end. So if you have a 3-month short-term contract or a 1-month short-term contract that's coming to an end at the end of the month, then you would be called in to sign your 3-year contract. What you're seeing here is just an example of what the beginning of those contracts look like, and that is going to be rolled out. And I wanted to be clear, because we are now at a point where we are shifting the pandemic, where we are now talking about COVID being endemic and not necessarily pandemic. We wanted those members of staff to know, those hardworking nurses, doctors, or everyone who was a part of helping us weather this storm, wanted them to know that you don't have to be worried. Because we are now moving from pandemic to endemic stage does not mean that you are going to lose your job, because we need you to help to keep building the health system. One of the other things that we did very clearly, or that I insisted on doing when we got into office, is to improve the level of health education and health awareness that happened. We've been dealing with this pandemic for the last 2 years. It has actually caused us to be home. As one of my colleagues said, many of us are now pleasantly plump as a result of it. And because of that, we needed to ensure that we started pushing those messages that needed to be out there again. Messages about, messages about getting vaccinated, messages about World TB Day. Now, it's also important to note that one of the things we started pushing is to ensure that our health professionals also started getting back out there doing the health education that we know they love doing. So we've been pushing that. Ensuring that we have blood drives going. By the way, that is also one of the things that we are going to be starting doing it in a different way in Trinidad and Tobago as it relates to getting blood. I am really, really at the point where we are sick of having those calls for blood drives because somebody is physically in the hospital and needs blood. What we are going to do is start rolling out a system where there is no chip. Once you are able to, once you are healthy enough, you should be able to just go to the health facility and give blood, because that is what is a good thing. And you would not even need to go to a health facility. If everything works out the way it should, we will come to you. So you'll just need to come out your door and you'll be able to give blood. I also want to highlight the fact that as we continue those health education awareness programs, and as I see some of my friends drinking their water, this was a perfect example of us all showing that, you know what, we are all part of this. We are all members of the community that need to be healthy. We need to be drinking more water and so forth. So these were all part of our health education. Yes, there goes Madam O strutting as she drank her water. doing this kind of stuff is what is really important, so that people get the message, so that they get the message in a way that is not intimidating, so that they recognize that those who are talking to you, those who are leading you, are actually walking the talk, and we are not just telling you to do something, but we are doing it ourselves. Now, this is one of those issues that has been a task, has been vexing, has been all sorts of story. When I got to the division, we realized that practically, let me not exaggerate, quite a number of individuals who had applied last year for their assistance, whether it was rental assistance, food assistance, assistance to buy appliances and so forth. We realized that those individuals, for some reason, those files who had gone through the process where the social workers and they had done their work and had said, yes, you are approved for this, but something prevented it from going that step further. So I've actually been spending the last couple weeks going through those files and signing the approvals. We are at this point where we have signed close to $600,000 worth of approvals that will go through. So if you are one of those people who last year, know that you applied for the rent, or you applied for the food, or you applied for the appliances and nothing happened, we have not forgotten you. We just wanted to ensure that the process was one that is done well, and I personally actually went through and signed off on many of those last week, so definitely expect a call. Of course, because health is an international issue, and because we were in the middle of a pandemic, I ensure that on coming in, the division worked very closely with organizations like the Pan American Health Organization to ensure that what we were doing in Tobago was actually best practice, and to ensure that what we were doing in Tobago was really the best, and not just doing it because that is what we thought we should do, but because there is evidence that shows that is the best way to do it. What you're seeing there are some of the test kits, for example. One of the first things we got was actual test kits from PAHO. They donated 15,000 COVID-19 test kits. What you're also seeing is me being a part of telemedicine and a host of other consultations where we've been working very closely with PAHO to ensure that the kind of health, the kind of social protection that we provide here on the island is second to none. I'm going to talk more about those in the next quarter because we'll be rolling out a couple other things. And I would also like to again congratulate the Chief Secretary for this push for digitization, because this is also part of that, where we are hoping to completely shift how we do medicine, how we do social support, how we provide the kind of care that is necessary without using the paper, without using those things that we are used to, but being able to be in different places and to do it digitally. And these were parts of the conversations to do that. Of course, we had quite a number of courtesy calls. I particularly love this one because this is one where we were with the Children's Authority. And that conversation with the Children's Authority is one that was so critical because we need to ensure that we protect our nation's children. And when we were having the conversation with them, I actually told them very blankly, very clearly that, you know, I care about our children in Tobago, and we need to ensure that we do what we have to do to have our children in Tobago protected. I love this image. I love this picture that it was given because it's actually a picture that was drawn by one of a young lady who is in my electoral district. And I didn't even know that she knew how to draw until, you know, another person said, yes, you know, Heavenly could draw a picture. And this was what Heavenly came up with, and I'm so proud of it. Again, a couple other courtesy calls that we had that shows the kind of collaboration, shows the kind of interaction, shows the kind of community partnerships that we need to continue to have. What I've shown here is just a couple of the community partnerships that we've already been engaged with within the last 3 months. Very early up was the Skip to Malou, which was a skipping competition. And this is where I discovered that there's actually a Trinidad and Tobago Skipping Federation that is actually responsible for having skipping and doing skipping as a sport and so forth. So this was pretty exciting. I would also like to congratulate and thank the Trinidad and Tobago Medical Association for partnering with me to have that Bell Garden community health outreach that we had a couple weeks ago. And again, I Walk with Pastor, which was another one of those community initiatives where we were asked to partner with the different entities, and we were able to do that successfully. Another one of the things that came out of our retreat was the plan to have continued white waste cleanup. What is white waste? You know, the old fridge and the old stove and those things that usually put out during Christmas time because we got new ones for Christmas. When I chatted with my public health officials, they indicated that this was so much bigger than just picking up horrible waste, that this was such a critical part of our larger infection control and mosquito eradication and that kind of thing. So we have committed to having these at least once per quarter, and we've already had our first quarter white waste pickup that ended last week. Again, we'll be doing it every quarter. Again, I want to really thank the Department of Public Health for all of the work that they have been doing to ensure that a project like this is successful. I want to wrap up my report by talking a little bit about our COVID management on the island. I came into this position probably what was the deadliest month of COVID-19 for the country and for Tobago specifically. And one of the things that we were tasked with was shifting the conversation, shifting the management of it. I actually worked very closely with our communications department, and we started going through rounds and rounds and rounds of examples where we finally came up with using this new methodology to present our COVID-19 related data, a mechanism that included giving you more information at quick glance instead of what was there before, which was very difficult to read, very difficult to follow. I am so thankful that we are at a position now where the number of deaths is so much lower than when we came in. I want to, at this point, thank our health professionals again, because they are the real heroes in this one. They are the real heroes in this one. They were able to work very hard, particularly all of them, our ICU doctors and so forth, who ensure that when you got very, very sick, they were actually there and they were able to help you. Another thing that I'm very, very proud of is the fact that we had so many individuals be a part of the volunteer call, and those individuals are continually being reached out to and are being asked to keep volunteering and to keep doing what they volunteer to do. The video that you are seeing is actually one that I thought was probably the proudest of the division in collaboration with the Tobago Regional Health Authority. What we are doing in this video is showing those of you who were living with COVID but at home how to breathe. And we partnered with the physiotherapy department at the Tobago Regional Health Authority to come up with, I think, 4 or 5 videos where they were showing you, hey, I know you're home, I know this might be difficult, but if you do these simple breathing exercises, this can actually help you survive COVID. And I wanted to do it that way because we wanted, again, to shift the narrative of COVID, where people did not feel that they were being sent home to be all by themselves and to weather the storm all by themselves, but we were giving them tools and techniques that you could use while you were there in collaboration with our community health officers who were checking up on them continually. I am going to end by showing this slide instead of a picture of our brand spanking new COVID-19 ICU. We got communications from 𝐿𝐷𝐶𝐀 last week indicating that our COVID-19 ICU up the fort was actually ready to be handed over and fit for use, meaning that we are able to provide ICU services up the fort for people with COVID-19. Now, I did not show the pictures of that because it is actually one of those facilities that I hope we never have to use. I want to bring to your attention the fact that we have a new variant, an XE variant, that is being detected in the UK right now. So yes, I know, today is Monday the 4th of April. Today is Mandate Monday, but for so many other people, today is you don't need your vaccination card again, Monday. And honestly, that thought process scares me so much. I have indicated to the Tobago Regional Health Authority that even though we've had extreme successes over the last couple weeks, that they should not think that this has ended, and that they should be ready and willing to re-engage our ICU if necessary. Again, I pray to God that we don't need it, but if we do, it is available for its use. Again, I would like to thank all of our professionals, particularly those who've been working in the field for the last 2 years. This pandemic has taught us that, you know what, everything that we thought was true, everything that we thought was working, everything that we thought was good, we had so many holes that we recognized needed to be plugged. And because of that, we needed to be very, very careful. And I want to thank everyone at the division, thank everyone at the TRHA, thank my Assistant Secretary, thank my colleagues in the Tobago House of Assembly, thank the Chief Secretary for your dutiful work over the last 3 months, because it is because of this entire team that we are able to be here now doing this. I thank you.
Thank you, Secretary Assemblyman Dr. Faith B. Israel. The Division of Food Security, Natural Resources, the Environment and Sustainable Development Secretary, Assemblyman Nathisha Charles Pantin, will now address you.